Hey, welcome back to the Urban Monk. Dr. Pedram Shojai here, live on Facebook. I'm excited. We're back, and we're back with a new format, which is really cool for me because I get to hang out with my guests and you get to hang out with my guests. So if you are watching this live, you can put questions in the chat thread, and Sean, who's over here, wave Sean. There he is. Sean will be able to read me the questions and grab us, and basically between myself and the guest kind of interface with us in your questions, which is for me a really fun way to involve you in the party. I got Dr. Jennifer Stagg here today. She is in Connecticut. She's a naturopathic doctor. Great title to a book. It's called Unzip Your Genes, and it's all about our environment and the environmental factors that either open up certain genes, express other genes, and it's just important stuff. It is where medicine is now and is headed in the future, and I think that this is something y'all need to know. So Doc, welcome to the show.
Hey, thanks for having me.
Yeah, so genetics, epigenetics, and all of these environmental factors that are causing our, either healthy states or our demise. It's a big deal, and you've obviously written a book on it. So what got you to start looking at this at first, from naturopathy into kind of epigenetics? That's an interesting turn.
Yeah, so, well, my background, I started out studying biochemistry and nutrition as an undergrad, and then I ended up going into a PhD program in biochem. So I was always kind of like deep into the research side of things. And in my PhD program, I ended up deciding I didn't want to be in a lab at 12 o'clock in the morning checking my chromatography columns, and I wanted to work with people. So then I decided I wanted to go to naturopathic school because it was a great blend of kind of the sciences for me. So while I was at Bastyr University, I continued to do research there. So for me, I've always been kind of like clinically and driven by science-based medicine, recognizing, the traditional methods. And now, interestingly, I would say that a lot of the traditional methods of naturopathic medicine that couldn't really be explained before are now starting to be fully explained because of the research that's coming out on genomics and epigenetics. So now, for example, we see stress. We've always worked with patients to control stress. So we're working out, the whole person. But stress, we know now, actually these elevated levels in cortisol end up affecting our DNA. So it actually can tag our DNA and change how gene patterns are being expressed, which explains why stress is such a huge, huge issue that needs to be always kind of like top of your mind and addressing with patients.
So let's look at this globally a little bit. Just, I'm assuming most of my audience knows a little bit about epigenetics, but I don't want to assume anything. Before, we used to think that your genes are your genes, mom and dad kicked them down, this is what you got, here's your life sentence, some of it's good, some of it's bad, but this is what you're stuck with. So
Yeah.
what do we now know about genomic expression that's different?
Yeah. So now we knew that back in the 70s, we knew that DNA expression required some kind of added information for the genes to be expressed. And so as scientists continue to study that, then that's when we started to understand these patterns of gene expression. And it was thought early in the game that the only patterns that made a difference were those that happened in utero. So things that happen while a fetus was developing could impact it. But now what it turns out is that how we're living, so things like our formative childhood years, stresses that we incur during that time, dietary patterns, but continuing into adulthood, even the foods that we are eating are affecting how our DNA is being expressed.
So even the foods that we are eating are affecting how our DNA is expressed, which is a really, really scary, sad statement for America because of the foods we have been eating, right? In the last couple generations, food is no longer food, and it's become all this processed stuff. And, we thought a calorie is a calorie, and so we turned it into an industry. And now with this revelation, there are a lot of things that need to be rethought. And so the difference between a processed food and a natural food that's really, unmolested, if you will, what does that do to the different kinds of genomic expression, or do we even know?
Yeah, so those are critical pieces of the equation. So when you take a food and strip it of all of its natural phytochemicals, that really does a number for us in terms of our health. So all of those phytochemicals that you continue to hear about, like resveratrol and superfoods like acai berry, all of these have basically these phytochemicals that are found to be higher levels in organic foods, first of all, which helps us to explain why organic foods are even better. Because some people will criticize organic foods that the vitamin and mineral content might not be that much different. But in an organic food basically gets naturally stressed in order to live, so it doesn't get pesticides. So you have these plants who are that are outputting these natural chemicals, and these are the chemicals that are higher that actually impact how our DNA is expressed in a positive way. So first of all, eating foods that are grown organically are actually going to make a huge difference for your health. And then these colors. So when you look down, I'll often describe to patients, when you look down at your plate and you see a sea of like white and brown, that's not going to do much in terms of helping you stay healthy. So when you look down, you see all these colorful pigments. That's when you're doing yourself some good service there.
And so most of us have kind of grown up being force-fed, some peas or some corn or whatever, and most of it's been starches and proteins, the standard American diet. And then once in a while, if your parents got lucky, you got broccoli if you took it, right? And so
Right.
now we know that these things unlock information, and they express for genes that do what? I want to get real kind of granular on this. So by me unzipping the right genes means what versus the wrong ones?
So this is where we can go into genetics. So people kind of back to that whole concept, thinking that okay, you have this set of genes that you inherited from your parents, and now you're stuck with that. You have nothing you can do for it. So say you have an increased risk of having diabetes, for example. So you've inherited specific genes which have been identified that could put you at an increased risk of developing diabetes. We know that eating a Mediterranean-style diet, that complex of a higher fat diet that's more monounsaturated fats, can actually turn off some of these genes associated with diabetes, and completely dissipate that risk in a patient who may be predisposed to diabetes. So now you can see, okay, well, it is important what I eat, and I can actually do something. I'm not just sentenced to getting diabetes when I turn 50.
Yeah, wouldn't that be nice? And so
Yeah.
you have this enormous industry, this medical pharmaceutical industry that basically lives off of diabetes. And I've heard studies that say up to 70% of hospital visits are due to complications of diabetes for all this chronic stuff. And so now we know that eating a certain way would actually create an environment internally that then codes for the genes to say, look, we're moving away from this diabetes situation and going to a healthier kind of resting state. That's huge. That's huge.
That is. Like it is massive. And so, yes, because of epigenetics, a lot of the research that's being done, of course, is being funded with pharmaceutical research looking at ways to turn off genes associated with cancer. But we know, and there's certainly a time and place for that for pharmaceuticals and oncology. But we already know that some of these plant pigments can affect tumor suppressor genes. So green tea, for example, the EGCG component in green tea has been shown to affect how genes are expressed that control cancer cell growth. So we already have some of these tools that could provide us the ability to change our risk factors in terms of cancer, diabetes, heart disease, all those chronic diseases.
Yeah, that's incredible. And so Then the question is, what kind of specific strategy can one adopt to really game this in their favor? I mean, I'm assuming it's multifactorial.
Absolutely. So that's kind of like, as a naturopath, this fits so well for what we do because we always look at people as the whole person. So we don't, and I'll routinely see people who are eating stellar diets, they're exercising, seems like everything's going right, and they're diagnosed with disease, serious diseases, cancer, autoimmune diseases. That's another big area. And what we know is then there's that whole, I'll often call it the elephant in the room. Like, what are we doing to deal with your stress? Because stress affects all this. So number one, we have to deal with that. We have to deal with their mindset. That's not just a simple thing because these are kind of ingrained patterns that they've often acted out for years and years and years. So it's not a simple switch off, but there's a lot of things that we can do. I always talk to patients about meditation first and foremost because we know that makes such a difference in terms of how we respond to the stressors in our life. So we can't get rid of all those stressors, but we can certainly affect how we're responding to the stressors. And then we're definitely looking at activity, making sure patients are actually moving. And we know that even a single workout, you can actually have changes in terms of epigenetics, like how DNA can be expressed after a single workout. And continuing to exercise regularly can actually change the risk associated with, again, various types of disease states. And diet, of course.
Yeah, so eating the right foods, exercising, bringing down stress, and everyone says go meditate, but no one does it. And so if you're watching this and you're thinking, oh, meditation, I heard meditation's good for me, but you don't meditate, then you're not getting the benefits. So sorry, you got to actually do it. What about all the stuff, the triclosan, the diesel fumes, all the the kitchen cleaning things, the things that are snuffing out our mitochondria and creating a lot of cellular duress?
Right. So that's another section of my book is talking about toxins in our environment. And it's a huge issue, massive, massive issue. And, I'm talking about epigenetics, but there's also the issue of oxidation, DNA damage. And that's what a lot of those chemicals in our environment are doing. So they're causing DNA damage. And a lot of these foods are going to provide antioxidant support as well as helping with epigenetics. But then it's talking to patients again about how can we get down your total load. So there are certain things that, you just can't avoid being exposed to. New furniture is covered in flame retardants, and there's not much of a way around that. For someone who's buying new furniture, a new car is going to be loaded in volatile chemicals. If you're moving into a new house, you're getting new carpet. These are things that a lot of times most people don't even think about. And there's some ways around it. But then you have the issue of patients who are more challenged in terms of their detoxification pathways. And so I talk about quite a bit in my book about how you can actually test you can have testing done to determine whether you have some genetic predisposition to have problems with detoxification, with nutrient levels that could be off, that you do have some of these inherent issues that maybe someone else who doesn't have that can have the same set of exposures and then they don't get sick. So then we have to provide specific supports around that.
Yeah, and so I just had this. I was flying to the East Coast, and I was on a flight where someone within 3 feet of me was wearing some really disgusting chemical cologne. And it was just, I could feel my system starting to get edgy, and I'm MTFHR, whatever, and so I have detox issues that I mitigate because I don't use that crap. But then you get yourself in a position where you're stuck on a plane next to someone who, you're exposed. And I used to have patients that would get laid up for a week or two from these types of exposures. And so how do you offset some of that? I mean that's just kind of, captivity there, like you're stuck being exposed, and that's a challenge. You can move your seat or whatever. But, do you use glutathione? Do you use certain things to help people with that, vitamin D?
It depends based on individuality. And that's another kind of core of naturopathic medicine, is treating people as individuals. And it's not just like a one size fits all. So if we have had some genetic testing done and we know where some of the issues lie, then we can specifically dose around those in terms of providing something like NAC, which is a precursor for glutathione. Do we need to have more sort of what we call standard methylation support for some people, or are we just talking about like a broad spectrum, if we don't know, detox kind of formula to help them kind of clear some of the exposures that they have? So yeah, we look at it, on a one by one basis.
Got it. So if I'm reading this and I can't see you in the clinic, and I'm trying to figure out how to shop for my family, it's obvious that, I got to buy things that grew out of the ground and all that. What do I need to avoid the most in the grocery store aisles?
Yeah, so it's processed food, definitely, because they're going to be devoid for the most part of all those phytochemicals that are so critical for health. And then whenever you can, buying organic, because it does make a difference. Because it's not just looking at pesticide residue. So, you got your dirty dozen. All of those, even if it doesn't have residual pesticide, it's still going to be aided in its growth. So then you don't have as much of those phytochemicals. So whenever, buying organic is going to be, top priority. And I understand that, that can be challenging financially for many people, but honestly, it's cheaper to eat a whole foods diet than it is to eat processed food. You just might need to put a little more work into it. But, whole foods can be cheap if you, you plan accordingly. You're not going into, if you're not buying a lot of kind of formulated and packaged, technically, like what's called whole foods. Yeah,
well, and that's what you're paying for. You're paying for the processing and the packaging, and what you're really also paying for is the health hit, which is a challenge. There's this stuff that you could get. Trader Joe's sells it. There's a bunch of these places that are like these vegetable washes. How good are they? And like if you were to buy conventional and then just get the magic sauce that like makes it clean, how good are those?
They're not. So they're not going to affect the phytochemical content. So that's done. It's a done deal. So now you just have this. Can't like add back phytochemicals. So you can wash off some of the residue that's on the outside of produce. But the pesticide is through the feed, like it's all through the food. So you're really not going to get a big improvement in health status, mainly because of it's devoid of the phytochemicals.
Got it. How long does it take to start to see a difference once you make a number of these changes and you're okay? Look, I'm eating the good stuff, I'm off the bad stuff, I'm trying to do my exercise. A lot of people get discouraged because they don't see results quickly, and therefore they think it's not working.
Yeah. And so we see that all the time because it's our culture. We expect results and quickly, right? And I do trainings for other doctors and lecture around the country. And I kind of describe like we're on the clock, right? So a patient comes to see you, they want results quickly, and you have to deliver for them. So for me, when we do genetic testing, if that's an option for patients financially to do genetic testing, and there are more cost-effective ways to do that now than ever, and you can kind of pick and choose. So there's ways. I always think about financial stress for patients too. That I definitely recognize that, and we try to find ways that it can be affordable, but that can allow us to really kind of like target where we can make a big difference for them. And so then it may be very specific supplementation. And if we do more sort of wellness genomic testing panels, then we can even put them on like a genetic matching diet. So beyond organic, there's the capability now to find out like what ratios of fats, carbs, and proteins that your genes are a good match to. So like you can find out, are you a match, like mine, I'm a match for Mediterranean diet. And I sort of always felt better when I ate that way. And so that made sense to me. And then my husband is also a match, but he could stray more so than me. Although he likes that diet, he could stray. And for a little while, he did stray quite a bit, and he got pretty unhealthy, and he's predisposed to diabetes. And he was starting to go in that direction. And then we've cleaned it all up, and Mediterranean diet has worked for him very well. So, and that can, meaning that you can compress that time frame if you start to use some of these new technologies that are available.
What are we talking about in terms of cost for kind of entry level to gourmet, and then does insurance cover it? Which is, I hate that question, but everyone asks it.
Right. No, yeah. So insurance occasionally will cover a couple of tests, but it could cover something like just an MTHFR test that you would do through a lab, like your standard Quest labs. Some insurance companies will cover that. You can do MTHFR panel with COMT out of pocket and only get it's only $75 for the lab that we use. So that's an affordable test.
That's not so bad. Yeah, that's not so bad.
Yeah. That is okay. Patients can afford to do that, and that can provide us a little bit of information. So we'll see someone who comes in with anxiety, or kids that are coming in with, I get to actually see a lot of kids with anxiety, and then ADHD. Some of those tests are really valuable. And then we know exactly what to, we're on the right track with what we can start to do, looking at like more of a global treatment plan. But then when you start to do more sort of like the genomic wellness panels, yes, the cost starts to go up, and insurance typically does not cover it. We were trying to use a company and get insurance to cover it, and really we found out most insurance companies are not covering that type of testing. And so out-of-pocket costs in that range can be, in our office, it's $300. But if we have a great arrangement where we're able to provide a lower cost test, but usually it costs $500 to $600. Some of them are $800 for these panels of more like 75 different tests. So when you start to look at that, you can do 3 for $75, but now you got 75 tests you can get for $300. That's a pretty good deal. Mm-hmm. And a lot of people are willing to make that investment. Yeah.
Well, I mean, so long as it gives you actionable data, I think a lot of people are frustrated with labs, especially in America, because, doctors keep writing for these labs. They have all these copays. They're paying hundreds of dollars in copays, and, they're not getting any better, but they're paying for all this information that isn't really actionable. So what does $300 buy me in actionable intel?
Yeah, so with that, it tells you what your genetic matching diet plan is. It tells you a set of eating behaviors, so we can actually find out kind of how you're wired to eat, what your food issues are. And so I see a lot of patients, certainly because it's such a big issue in our country, who are dealing with problems with weight. And they've tried all the diets, and they don't even know what to do anymore. Things are not working for them the way it used to. And so then we'll do genetic testing on them. And a lot of times there are food issues, and then we can specifically target with behavioral modification exactly what that is. So it might be something like we can find out that they're predisposed to have something called eating disinhibition. So they would be what you would classically call a stress eater, or they have trouble to stop eating. So then strategies around that would be like, okay, well, if you're in a restaurant, they bring bread to the table, you say like, don't bring the bread, just keep it away from me. You don't sit down with an open bag of like even healthy foods like nuts and just like eat from the bag. You have to portion control. So we can get like great targeted behavioral modifications. On that panel, we also find out about vitamin deficiencies, like there is an MTHFR on there. Looking at, do they absorb B12 well, vitamin C. We see exercise response on there too. So now we're kind of getting more kind of full circle on what we can offer in terms of advice based on it. But we can tell whether someone responds really well to aerobic exercise, if maybe anaerobic like weights might not be so good an option for some people. There's actually a gene variant that people can have where they end up building fat mass into their muscle if they overdo it on weights. And so I'll have women, and that's only been shown in men, but I've had women who have tested for this gene, and they come in and they're like, I swear I get fat if I'm just like going hard, like 2 hours in the gym using weights. And then we'll find this test positive. So then we change around their exercise plan a little bit, not like taking out weights completely, but focusing a little bit more on aerobic exercise. We can find out if you have obesity genes. So there are actually 2 genes for obesity. And so then we kind of know what we're up against to a degree. And there are a number of other gene variants around like impairments that you could have with weight management. So those are nice to see. Even adiponectin, that some people could potentially have issues with that. And then we would have specific strategies there. And then, of course, risks of diabetes and lipid abnormalities are on there, too. So it's a pretty, like, comprehensive profile.
I love that. And so you have this array of information that then gives you actionable data, basically saying, look, here are your predispositions. So stay within these bumpers, and your genes are telling us that this is what they like and how they like to express. And then at that point, we'll know what kind of exercise, what kind of food, what to avoid, and all that. And yeah, I mean, again, so the question is, how long? So someone comes in and they're relatively unhealthy. And so we know what conventional medicine does, right? It puts Band-Aids on it, and you can stay unhealthy for the rest of your life, really. In this model, you come in, you're relatively unhealthy, but now you have this information and you actually listen to the guidelines here. How quickly do you start to see the results rolling in, and how fast does it compound?
Yeah, so it depends on how long they've been sick, really. Mm-hmm. So to turn around someone's health in a month completely is just not realistic. Yep. So I often explain to them, it took you years to get here, and to get you back into an excellent state of health, it's going to take a while. So over the course of a year, I would say, we're going to continue to see gradual improvement, but it depends on where they are, like what type of diet they're already eating. Like if they're eating relatively healthy, and this kind of goes back to that epigenetic piece, they're already eating organic foods, they're eating, some of these foods that are helping their DNA get expressed in a healthy pattern, then they wouldn't be experiencing like such a radical difference in their diet as someone who comes in eating like a standard American diet. And now we put them on a actual like organic, healthy diet that is actually matched in terms of its macronutrients. Then on top of it, then you would have such a difference. So your body would be seeing such different fuel that would make a huge difference for them. And they probably notice like feeling better just with that dietary change within days, really.
Mm-hmm. Yeah, absolutely. Well, yeah, it's if you're that far gone, it's amazing. Yeah. I've seen people just go vegetarian for a weekend and have like life-changing epiphanies. Yeah. And so, yeah, it just depends on how dirty the canvas is too. So, yeah.
No doubt. Yeah.
What is this test? Is it saliva? Is it blood? How does this test get gathered?
This test is saliva, which is a great way to collect this information, and it's easy. It's a kit that we actually send our patients home with. So they're basically, we call it like it's patients could we get a lot of referrals for it also, and people will call up and say, oh, I wanted to get that spit test. Like, yes, we give you a spit test. So yeah, that one's just a vial of saliva. And then some of those targeted SNPs that we do, gene testing that we do, like the MTHFR panel, is saliva also. And it's just little paper discs that you put in your mouth for like 30 seconds. And so then that's a really excellent way to test some of the kids that we see in our practice.
But the main one includes the smaller SNPs too, right? Well,
The big one will cover, it has MTHFR on it, the one that we're currently using, but it doesn't have COMT. So if we're just like looking at the wellness side of things and we're not dealing with more so like more complex issues like mood disorders and, developmental disorders and neurological issues, then we could stick more so with wellness testing versus needing to do more of these targeted profiles that
yeah.
is someone more like psych symptoms we need to do.
Man, this has really come a long way. I mean, just in the last couple of years, it's getting
Yeah.
more and more interesting. And so I'm
Yeah.
sure you got a lot of reading to do to keep up with all this.
Oh yeah, absolutely. Yeah. I would say like the biggest point I often make to patients is that, and I definitely stated in my book, is that it's more of kind of also prompting this paradigm shift of promoting health and wellness versus always focusing and treating disease. And what we're seeing on the genetics side is that there are more genes for health than there are for disease. So everyone, all the research, has historically been focused on studying genes and genetic causes of diseases. But now there's actually a resilience project, a gene resilience project, where they're starting to look at, well, why do some people seeming like stay so healthy? That what are these genes that are keeping people healthy, and what can we do to keep them turned on, and focus on optimal like health and wellness instead of targeted treatment of disease. So that's kind of like a what I would call a big paradigm shift in medicine.
That's really encouraging, because at the end of the day, I mean, there's a million things that can break your back, but what keeps you going?
Right.
I got a question from our audience. I'm going to cut to Sean over here, and he'll ask, tell us what was. Go for it.
Awesome. So how many people do you think when they get the results, it's something that they already knew that they had to make the lifestyle change? Or how many do you think it's actually just a real wake-up call when they get the results or the data back?
Cool. Did you hear that?
I didn't hear all of it.
So how many people, when they get the results, it's like, yeah, I kind of already knew that, versus like, wow, this is really a profound piece of information. This is not something I would have assumed or known.
Yeah. So, I mean, definitely with the dietary pattern, that one, like what your matching diet would be, no one really knows that. Like, that's just, oh, okay, should I be eating a low fat diet? I mean, the difference could be you should really be eating 20% of your calories as fat versus 35, which is like a big difference. And many, many studies looking at this, and it can really tip the balance for some people. So something like that, they don't know. There's no way anyone would know that. But the eating behavior SNPs, a lot of times people know those. They're like, oh yeah, I do that. Like food desire is another one of them, where people are just kind of constantly thinking about food, and they're eating and thinking about like what their next meal is going to be. They definitely identify with those patterns. Now with the obesity genes, it never seems to really make sense. So people will come in and they'll say, well, there's obesity in my family, and I figured I'd have the obesity genes, and they don't. Or we have patients, and they may be overweight themselves, so they're thinking, well, I must be predisposed to this. And so then telling them you don't even have the obesity genes, then sometimes that can change their mindset. So they're like, oh, well, things shift for them because they think like, well, I'm just meant to be obese and this is it. Versus like, oh, well, I don't even have this. There's, I can really take some steps to affect my outcome. On the other hand, patients who actually are told that they have the obesity genes, and with this type of genetic testing in general, there have been a couple of studies now where the actual process of having genetic testing for this type of genetic testing, patients actually become healthier as a result of it. So they, learning this information, understanding, oh, I have the obesity genes, I'm really going to do something about this. It motivates them to make healthier choices above and beyond what just a typical office visit could do, or, a dietary program. So that piece of the equation, I kind of like talk about that in my book maybe, and suggest that one of the things that we could be doing to actually make a big difference in our health is have genetic testing, because it could change how you start to think about your body, right? That you kind of get a better understanding of it.
Absolutely. Do you find some of the similar gnosis with exercise behavior? Like people just intuitively know that cardio sucks for them, but lifting weights works, or vice versa? Or is that one also kind of surprising?
Yeah, some of that is there, because you can even, there's exercise capacity in terms of like how your oxygenation would work in terms of muscle. And so some people who have that, like, yes, they can benefit from cardio, but they have like they're predisposed to have poor oxygen capacity, and then they know like cardio is hard for them. Like they don't like cardio, but it's good for them. So they kind of know that. And then, you know, the thing that I talked about with the anaerobic exercise. But then there are a couple of other SNPs I didn't mention on there. One for the sprinter's gene. So there's actually this gene that has been quite extensively studied in Olympian weightlifters and sprinters, and they all have it, but they all have a lot of other genes too. There's a lot that goes into becoming an Olympic level athlete. But the patients who end up having the sprinter's gene, they're like, oh yeah, I was really good, like in their high school or college, like they were a fast runner, like they kind of like know that makes sense for them. So that's kind of interesting. And there's another interesting one is that there's a gene for Achilles tendinopathy, that you could be predisposed to injuring your Achilles. And we actually have a patient in our practice who runs marathons, and he's under 30, and he's actually injured his Achilles. I think he's on his third injury now, and we ended up doing genetic testing on him, and he had that. So it makes complete sense. Yeah.
What if I wanted to unlock my sprinter gene and I didn't have it? Is that you know, can I do a grab bag here? Like, how does that work?
Not yet, but I won't get into it. But there's this whole new, not even that new, but there's technology that is not available for clinical use yet, and probably won't be for some time, called CRISPR, where you can actually splice genes in and out of DNA. So there's a lot of controversy around that, of the potential of being able to have a designer baby. You'll see a lot of blogs and articles written about this, but the clinical utilization they're looking at is, can we splice out genes that predispose people for cancer? Mm-hmm. So it sounds kind of science fiction, but it's like in the pipeline.
It's here. Yeah. No, the future is now. Yeah. No, these are really, really interesting times. And, you know, there's also been this whole thing with stem cells where now you could, you know, spin fat and take it from marrow, and there's all kinds of, and there's this huge stem cell revolution happening all over the country with clinics, you know, reporting some really interesting stuff. And it's also, there's some monkeys doing things that they shouldn't be doing as usual, right? Yeah. But, you know, that's also opened us up to a whole other realm of research and some clinical efficacy that we didn't think we'd have for a while.
Right. Yeah, it's a really exciting time. And this type of technology has developed so rapidly. It's kind of ahead of what I would call like clinical ability to use it to a degree. So some of the test results that we can get back in some of these areas are above and beyond any sort of, you know, way to utilize it. So right now it's an art. People are, you know, figuring it out, self-studying. But the precision medicine initiative that President Obama announced in his 2015 State of the Union address is allowing for much more research and promotion of this whole concept of precision medicine. So that's exciting to see that area being emphasized in medicine.
Yeah. You know, it's fascinating. You know, on one hand, you have all this really new, interesting stuff. On the other hand, everyone's, you know, going to herbs and shamanism and all these other things, and everyone's trying everything they can to get well. Because what we do know is that the conventional medical model isn't working, and there's plenty of things that are interventions in conventional medicine that are fine. But this whole lifestyle disease paradigm that leads to overuse of pharmaceuticals is broken. And so people talking about fixing healthcare, it's not healthcare reform, it's healthcare finance reform, and they're just trying to figure out how to pay for it. But what we're trying to do is figure out how to actually find wellness within the community and the population, which is a different conversation.
Yeah.
It's a challenging one because, literally, I know gajillions of patients that I've had, once they knew what they needed to do, still didn't do it. And then you're talking about a whole different ballgame.
Yeah. Yeah. So that's that compliance issue. And that's always been a big problem when you're dealing with lifestyle induced chronic disease. And for me, when I started using genetic testing, it helped kind of start to change that compliance issue for me. That people are understanding that, oh, well, wow, like actually having a test result in front of them that's actionable, and is very, specific for them, but a way that they could improve their health that is science-based. People really kind of resonate with that, and I think it's a powerful tool that we have been basically gifted.
Yeah, I love it. I actually want to do that test. I want some of that. That sounds great. The more knowledge you have, the better equipped you are to face what's coming at you. And so, we try to mitigate as much as we can. I got a whole water filtration system for my house. We don't bring the junk in, but then I get on a flight to go teach Qigong across the country, and I'm sitting next to like Gucci cologne, and
Right.
and so that's life. That's life in the modern world. It's really challenging to avoid all exposure. So what do I got to do on the front end to build out my sprinter genes or whatever it is?
Right. Yeah, so it is. It's being armed with as much knowledge as you can get, and that's kind of where this whole system is going, is trying to put patients in charge of their own health, right? To get people up in front of that and feeling like they're empowered. A lot of times when I go over these results with patients, especially women, they have a lot of guilt around eating and around like their weight, and they start to understand, oh, well, maybe, this is how I was wired and there's something I can do about this. It's not just my fault. So that has been a great aid for me in terms of being able to help more patients.
Yeah, that's really good. There are so many places that people are searching for answers. There's the tabloids, right? There are all these kind of like popular health mags that are like 6 ways to get your abs done. I'm sure the Pentecostal people have something. I mean, everyone's got something, right? It's crazy, and so. What you are bringing is sane scientific testing that is basically set up to allow us to know more about ourselves. So to me, it's a tool for gnosis. And I think that we're in a very, very interesting time where now we have access to information that is here and now. And so how long before I spit in this thing, send it off, and get my results back?
Typically about 3 weeks.
3 weeks from now, okay, so I do this test. 3 weeks from now, I now have information. I would obviously sit with a doctor who would read it and interpret it, because it's not easy.
Right. That's critical, that piece of it. So when people just walk away and they have this information they don't know what to do with, that doesn't serve you in any way. So it's that genetic counseling piece to help you develop an actionable plan. But it is like it ends up, and what I talk about in my book is kind of like going back to basics. It's really, there's no quick fix. You need to like control your stress. You need to be active. I didn't get into the microbiome, but that's a big, I have got a couple of sections in there on that, but that's a big part of the equation, more and more. And I know if you had like podcasts devoted completely to the microbiome. And then it matters what you eat. It does matter what your diet looks like, and it's not just about calories.
That's it. So look, I love what you're doing. The book is called Unzip Your Genes, out today?
It is out
today. Awesome. And so this is the future of medicine. So I highly recommend checking out this work. And her name, Dr. Jennifer Stagg, double G, Dr. Jennifer Stagg. And how else can people find you? You got a website, clinic site?
Yeah, a website. So our clinic site is wholehealthllc.com. And we do consults out of state, and there is we can order, get you the test. We don't order it, but we have, you order it through a company. So you can actually get the test and go over the results with us. We have a couple of naturopathic doctors who really know their stuff, and know their, how to go over these results. And then, I'm on all the social media sources. So you can follow me on Twitter and Instagram, Facebook. I'm there.
Cool. And you know what? I'd love to do this. So if I pay for a test and do it, would you get on a part 2, a follow-up of this, and read my results live? I don't care. Yeah?
Yeah, we actually did that with a TV host and did his results on the air, and it was a great segment.
Yeah, no, I'd love to do that. I've done that once before. Myself and Sarah Godfrey did that a few years back, right after I had a kid, and my adrenals were like down there somewhere. And so, I don't care. I'm just human. So whatever. I'm happy to do it, and I'd love to see this process unfold, and I'm happy to be the guinea pig for it. So we'll make preparations for that. So Dr. Jennifer Stagg, Unzip Your Genes. Thank you so much. This has been great.
Thanks for having me. It's fun.
Yeah, it's great. And for my audience in Facebook land right now, we're live. As you can see now, we're starting to take questions, and we're opening up our new format. Let me know what you thought about this one, and we'll get the blog and all this stuff out usually about a week after we go live here. And let me know what you think, and I'll see you next time.